Hello, everyone, and welcome to the webinar today. I'm very excited to have you all to our latest UpDog webinar. And today we have some wonderful guests from PSI Madagascar and Aerial Metric, who are going to be speaking about improving the reliability of primary care services with drones in Madagascar. So I'm just going to get us started today with a couple of housekeeping items. First of all, my name is Gabo Ailstock. I am one of the UpDog coordinators, and I am your host today. The webinar is going to be 1 hour in length, and we're going to have about 35 minutes of presentation and 20 minutes of questions and answers. And this webinar will be recorded, and we will send it to you afterwards next week via email, and it will also be available on updog.org. So we have a couple of ways that you can participate today through the discussion. The first way is if you would like to participate non-verbally, you can do that through the Q&A feature at the bottom of your screen. I will ask some of the questions to the panelists, and if we don't get to all of your questions today, we will follow up with those by email. And the second way is if you would like to contribute verbally to the discussion, you can use the raise hand feature at the bottom of your screen. I will invite you to speak. You'll get a little pop-up here on your window that says the host would like you to unmute your microphone. You can unmute yourself and then go ahead and ask your question to the panelists. And now I will introduce our guest presenters today, who we're very excited to have here from PSI Madagascar and Aerial Metric. So first, Sandra Rehan-Tajimi has been the drone project coordinator at PSI Madagascar since its inception, and she's intimately engaged in the design, planning, and rollout of the project at the field level and managing the donor and government relationships at the national and international level. Daniel Crapper is the country representative of PSI Madagascar with over 20 years of experience working in public health interventions across Africa and Asia. His particular area of interest is in identifying scalable interventions and building the business case for donors and other partners to make investments. And finally, we have Stéphane Bier, the director of Aerial Metric, who is a French/Madagascar company that has been designing and developing aeronautical solutions for mapping services in Africa, particularly in Madagascar, for close to 15 years. And over the past 5 years, they've been working hand in hand with the government of Madagascar and PSI, and have become the second largest employer of young aviation professionals in Madagascar after Air Madagascar. So I will turn it over to our presenters now to let them get started.
Okay, I think, sorry, this is Daniel Crapper here. I think I'm starting off with a bit of project background for you. So maybe we can move to the first slide. Okay, so just very quickly to introduce PSI. I don't know how many of you out there know PSI, but we're a public health organization that have been working for over 50 years globally and over 20 years in Madagascar. What we do, we try and make it easier for people in places like Madagascar to lead healthier lives and plan the families that they desire. Part of our job is to reimagine how to bring quality healthcare closer to those who need it most. And our work under this project is certainly a fantastic example of that. In Madagascar, we work closely with the Ministry of Health. Our focus areas are around mainly communicable diseases, but also family planning. So malaria, maternal, neonatal and child health, nutrition, HIV prevention, reproductive health and family planning are certainly core. In many countries, we also work increasingly with non-communicable diseases, but for the moment, that's not our priority in Madagascar. We're a not-for-profit organization, so we rely on donations from our big partners. You'll hear us talk a lot today about USAID and about the Global Fund, but we also work with private foundations. And we have many local partners that sometimes are providing finance, sometimes we're working with, and we are providing finance to them. I think many of you may have seen in the introduction to the website, so I don't want to go through too much detail, and we'll see a video in a moment. But Madagascar is a country that has some of the biggest supply chain challenges around the world. The infrastructure here is weak, is probably a fair way of putting it. There are very few resources for investing in it. The geographical conditions are quite extreme, both weather-wise and just distances relative to the number of people we have. In many ways, it's hard to find people. The density is very low. We have seasonal flooding, and we have a lot of insecurity in the sense of real danger to people who are having to carry out work, certainly in the field. We at PSI experienced one of our partners, I'm sorry to say, was killed in an incident with bandits, would be probably the best way of putting it. And that was in the last 12 months. And when that happens, it changes our ability to serve some of the clients, the people, the vulnerable people that we're here to bring services to. So you see the picture on the right. You'll see more in the video in a moment. In order for the government to supply the facilities that are out there, the public health facilities, people would typically be walking several hours using small pirogues. I think a beautiful picture there. The last mile is very much seat of the pants, and it's a massive challenge. I think you'll see that some of the places we work in can take 60, 70 hours for products to be transported from what might be called the district pharmacy to the place where it's needed. And even there, we're only there at the community health center, which the word CSB that you have there. And we haven't even got onto the community health workers who will pick up their product at that point and move on. As you can imagine, part of the challenge we face is frequent stock out in health facilities. Okay. Next slide, please. So I'd like to take at this stage a moment to laud my predecessor, Pierre-Louis Lesage, who conceived this project along with Ariel Metric and my colleagues at PSI. I'm here relatively recently and able to take all the credit, which is very nice. So we set out to look at a solution for Madagascar, which involved the delivery of health products by drone to hard to reach areas. The project itself was conceived earlier, but really began in 2019 with the financing, and we received, and we're very grateful to say, we received support from USAID and from the Global Fund. Very simple goals: ensure availability of health products, minimize the frequency of stockouts. Another interesting goal was the ability to improve the conducting of epidemiological surveillance. I think Stefan will talk a bit about that. The ability to bring biological samples from remote places into places where analysis can be done. We've been working with two different types of delivery point. The first we would call the CSB, the Centre de Santé de Base. This is a public health facility. It would typically have in a remote place, have a nurse who's in charge. It may have up to 4 or 5 people working there. Some are part-time, some are paid, some are not. And it's really a health facility that serves in the region of maybe 10,000 people. That could be about 2,000 households. At the same time, PSI, with our USAID funding, we've been working with what's almost a parallel distribution system of getting product out to community health workers. And this has been, so in the past, the system of supply points has been separate from the system of community health facilities of the CSB. In the future, I'm pleased to say that the decision has been taken to integrate the community health workers into the public health facilities. So the slightly artificial separation of our two approaches between community health workers and the public facilities, that distinction will go away, and we hope to be able to supply just to the community health centers, which will then become the supply point for the community health workers. And that will become a more rational system. And again, we'll see in the future that our community health work, our drone project will become more of a unified, integrated delivery point. Thank you. Just a final comment there. The challenge we face with those two different groups is quite different. For the community health system, the community CSB, the Centre de Santé de Base, this is a public health facility. Typically, stockouts are a major problem that we face there. With the community health workers, mainly through the fact that we've had considerable investment from USAID, stockouts were never a problem, but that's because an organization such as PSI has been able to supply, supply intense resources for delivery, for supervision, for follow-up with motorbikes and people really traveling the distance. So stockouts were never the problem there, but distance, investment, follow-up, quality assurance, those are the kind of problems that we faced at scale. Moving on quickly, we're looking at the districts here. So we can see we're up in the northeast of Madagascar. We had an original plan to work with 10 districts. You'll see that we've had some challenges around, certainly with COVID, because the 2020 was really our scale-up period. And in the end, we managed to work in 4 districts. Which these 4 districts have about 86 public health facilities, the CSB that I was talking about, and 51 supply points. These are the access points for the community health workers to obtain their product. Very quickly, these are very remote areas. You'll see that in the video in a second. Next slide, please. Okay. I think Sandra, we're now moving towards, we're going to play the video, is that right? Thank you, yeah.
The Basic Health Center, or BHC. In Madagascar, 80.7% of the population lives in rural areas and refers to the Basic Health Center, or BHC, to seek healthcare and to receive medicines and/or medical tests. For the basic health centers of the Big Island, the majority are located in landlocked and difficult-to-access areas.
Delivery of medicines from the district headquarters to the basic health centers is quite complicated. This is why we institute the drone project, which is an effective solution to facilitate the supply of these products. In order to get medicines or to transport analyses, we normally have to travel for miles and days. Therefore, a long waiting period is necessary for patients to get their medicines and the results of their analysis.
PSI Madagascar, a large international NGO financed by Global Fund and USAID under the supervision of the Ministry of Public Health, has innovated the delivery of health supplies and the transport of medical samples for maternal, newborn, and child health, family planning, immunizations, and malaria in very remote areas using drones. Initially implemented in the district of Maronsecha, Analanzarufu region, the drone project, funded by Global Fund and implemented by PSI, has started its extension to other districts, namely Mananara North and Tamatave 2, and currently has a fleet of 6 drones. The drones in use have the capacity to deliver health supplies to the BHC in remote areas by airdrop or by landing and taking off directly at these centers. They can also transport biological samples. Today, the technical team has to prepare the shipment of drugs and vaccines.
The drone is 3.30 meters tall. Its weight is 20 kilograms. It can carry up to 10 kilograms of products, about 600 doses of vaccines with solvents and syringes, or 200 TDR kits in a volume of 12 liters for distances less than 50 kilometers. In 50 kilometers, the drugs are stored in 2 capsules located under the wings of the aircraft and can contain 3 liters each. The altitude is 150 meters from the ground with an average speed of 100 kilometers per hour. It is able to withstand rain and winds above 35 kilometers per hour.
The Beneficiary Health Center is located in Mananara Nord, a locality located 100 kilometers from Maronsecha, the takeoff site of the drone. Under the instructions of the head of the BHC, the person responsible for health supplies at this BHC places the order with PSI Madagascar, which plans the drone delivery program according to the needs of the BHC. The head of the BHC is then informed of the date and time of delivery of their order. The preparation of the package is done at the district storage warehouse. Simultaneously, the aerial metric team prepares for the flight, and several checks are made. Thus, the drone takes off and travels a long way to deliver the health inputs to the BHC. The head of the BHC then confirms to the focal point of the drone in Maransetra the receipt of the package.
From our BHC, it is also possible for us to send packages, including RMA, biological elements from PFA, or missiles-related samples to the district.
The arrival of a drone in our remote village is a source of joy for us. From now on, the supply of medicines and the delivery of test results will be done as soon as possible.
The use of drone is important to transport medicines to the BHC and especially to transport them to the community site. Before the advent of this project that allowed us to have a drone at our disposal, the supply of medicines for Maransetra was a real obstacle course. The dilapidated state of the road, the use of canoes, and the length of distance were all factors delaying the delivery. Today, this will soon be nothing more than a bad memory. Everything is now done in a fast way. No need to leave the BHC.
Since July 2020, we have flown over 225 flights, and these drones have covered more than 10,800 kilometers to serve 35 remote community health centers. It is in this way that we've been able to deliver malaria treatments, malaria testing kits, family planning products, and also child vaccinations. We've even, more recently, begun to collect biological samples from the remote communities and deliver them to the central health authorities. It is in this way that we are helping communities achieve their goal of universal health coverage. I think we need to return to the presentation.
Général Henri Benteja, bonjour.
Bonjour monsieur.
Vous avez été chef d'état-major des armées, vous avez été adjoint puis chef d'état-major particulier auprès de François Mitterrand et de Jacques Chirac. Vous publiez aux éditions Perrin Les Ors de la République.
Okay, next slide, please, for Stefan.
Okay, do you hear me? Okay.
Yes.
Yeah, so as Gabriela said, Ariel Maitrise is a French Madagascar company that has been designing and developing aeronautical solutions for mapping services in Africa. And after a long feasibility study, we have designed a drone adapted to PSI needs. In terms of volume and weight of product transported, as you can see, we can transport up to 10 kilograms and 12 liters. In terms of distance to be crossed between the takeoff point and the villages to be served, so about 1,000 kilometers maximum of delivery distance. And in terms of resistance to climatic conditions, temperatures, humidity, and wind. So the design drone has a wingspan of 3.3 meters for a maximum weight of 33 kilograms. and it carry up to 10 kilograms, as I said, and at a distance up to 100 kilometers from the takeoff points. So we can do that while still having about 40% of batteries available after landing. So we can make 100 kilometers, so 200 kilometers of flight, 100 kilometers of distance for the delivery of products, and still have 40% of battery left after landing. So the communication with the ground station is made by Wi-Fi, radio, GSM, and satellites, depending on the available network and the distance between the drone and the ground station. So next slide. So we made more than 700 flights from the northeast of Madagascar. So it is the rainiest region of Madagascar, between 4 and 8 meters of rain per year. So we fly almost every day in the rain, at least once a week. And the region is exposed to winds coming from the Indian Ocean, most often between 25 and 35 kilometers per hour. But we flew very often with winds at 50 kilometers per hour during landing and takeoff. So, and more than 70 kilometers per hour during the cruise flight. And we fly over the sea almost every day, and as well as over mountains, about 1,000 meters mountains. So in next slide, you can see that we can land on the CSBs, so the small hospitals in the rural regions, to collect biological samples, for example. So this is done automatically on a trampoline with a kind of QR code that you can see on the slide. So thanks to an artificial intelligence system, the drone lands on this QR code. And we train the hospital managers to secure the landing zone and place the package in the drone. So it's very easy to place the package, and the takeoff command of the drone is done remotely by the drone operator.
Okay.
Yeah.
Okay. Thank you, Stefan. So, hi everyone, my name is Sandra, and I will present the supply chain design and result. Next slide, please. So, the project has 3 phases. The first one is the delivery in area with the network coverage. So, PSI agent and PA or CSB use phone to communicate before, during, and after the delivery. The kind of delivery is a drop-in on the job zone. For phase 2, it's a delivery in area without cell network coverage. For this kind of delivery, the delivery is scheduled in advance with the CSB chief or with the PA. And for example, for one CSB, the delivery of vaccine, for example, is every Monday at 9 a.m. So the CSB chief waits in the job zone. And if a drone doesn't pass, for example, Monday, so the delivery is delayed the next day at the same time. For the phase 3, the drone is landing on the CSB and can transport back to the base biological samples. This kind of delivery needs area with a network. Please, next slide. So this is about steps during the project, beginning with the identification of the human resources, as well as the coordinator of the project, the monitoring and evaluation supervisor, the supply point supervisor, agent of PSI in the field, and the drone operator for aerial metrics. The first activity is the courtesy visit at each level, region, district, township, and Fuktan, in order to present the project and to involve local authorities. Also, then a procedure was developed for data collect for flight and delivery and incident management, and all team was trained about these procedures as PSI staff, drone operator, and health worker. After that, data collect to geolocalize the PI and CSB. As Stefan said, the drone is designed according to the need of PSI. For sensitization, the sensitization is by radio spot and also posters and discussion or a meeting with local population to inform them about the project. Then the flight test and the delivery of a PI and CSB needs. Please next. So this is the delivery circuit of the project. So PI communicate with the supply point supervisor to make orders, and the CSB communicate with the responsible of a district warehouse of the Ministry of Health to send orders. Then PSI Madagascar scheduled the delivery, and this delivery schedule is shared to aerial metric and the PSI agent. PSI agent informed the CSB or PA about the date and time of delivery, and also picking products in district warehouse. Then products are transported to aerial metric, and aerial metric make the delivery of the packaging to the CSB or PA. Then the CSB or PA confirm the reception of the package by text message or call to the PSA agent. After that, PSA agent make the delivery report and aerial metric the flight report. Next slide, please. So about the result. Okay. During 12 months, more than 550 flights were done, with more than 99% of successful flights and less than 1% of incident. So the number of PI served is 34 and 35 for CSB. The most long delivery range is 100 kilometers from takeoff point to the CSB, and 100 kilometers in addition from the CSB or PA to the base, to the takeoff point. So 200 kilometers. The duration of the delivery by drone is less than 1 hour. So it's a big opportunity for CSB and PA to be delivered by the drone, because they can save more than 99% of their time. Normally, if they should waste several hours to pick up health product in the district warehouse, the drone can deliver their needs in less than 1 hour. So these are also details about successful flights and incident on PI and CSB during these 12 months. Next, please. So what kind of health products? Firstly, family planning delivered in supply points or PA, We delivered oral contraceptive like Xenia, combination, free, microgynon. Also injectable contraceptive like Cyanopress and Triclofem. And also condom mal protector plus. Next, please. The drone transported also maternal, neonatal, and child health to PA, like Pneumox, ORS5, and ARFOOT. About water purification, we delivered Suro in supply points. Next, please. For malaria treatment, we delivered kit RDT at the public health facility or CSB, and also SP and ACT. Next, please. About vaccine, 8 types of vaccine were delivered into CSB with more than 3,800 doses and more than 19,000 children vaccinated between July and December 2020. These vaccines are, please, can you come? Thank you. These vaccines are polio vaccine or tetanus vaccine or pneumococcal vaccine, measles vaccine or BCG. Yes, next, please. So for the phase 3 of the project, as I explained in the beginning, the landing and takeoff in CSB during 2 months, we studied the simulation of transport of biological samples from CSB to Maronteja district to support polio eradications. So flights tests were successful. Landing and takeoff was successful. Biological samples arrived safely in district, and cold chain was respected. I think next, please. So about lessons learned. Okay, next, please. Good practice. So the delivery in hard to reach community is successful, and we tested the phase 1, phase 2, and phase 3 of the project. About communication and partnership, the involvement of the local authority in the beginning of the project facilitate realizations. And but sensitization, posters, radio, spot, and meeting with local authorities, with local population, sorry, reassures them and facilitate also the realization of activities and also the collaboration with all partners. The use of a parachute is really important for the delivery, and design and information on the box are really important to avoid that the package is lost. Next, please. About lessons learned. When there is an incident, it's really important to make a field trip and to discuss with local authorities to inform and explain them what happened. Also, it's really important to always inform and involve local authorities in each step of the project. About delivery, not overload the package. It means that we should respect the minimum and maximum package weight that the drone can transport. Respect also the number of flights possible per day to avoid incident. And also, one recommendation is to develop a waste management plan. I think that's all for me. So Daniel will talk about next step, and Stefan. Thank you. Please, Daniel.
Okay, thank you. Thank you, Sandra, for a very long and detailed presentation there. We've left you carrying all the hard work. So, you know, what are some perspectives for the future? I think ultimately, okay, what I think we managed to do so far is really prove the concept of drone delivery. I think our aim, our ultimate goal, is really to take something that is innovative and exciting and one day to make it ordinary and boring, with the idea that the Ministry of Health, we have something called Salama, which is the Centrale d'Achat, which is the central procurement system. We would like it to make it as easy for them to choose to make a delivery through a drone as it is to choose to hire a truck to take products from point A to point B. So that's ultimately the idea, that it becomes integrated into the national supply chain system. One of the limitations, linked to that up to now, one of the, I call it a limitation, but it's understandable in the context, is that we've been focusing very much on certain programs and often fairly vertical. I'm very proud that they range widely, from family planning to malaria to maternal child health and other areas. But what we haven't really done is start from the point of view of the community itself. So if you look at the health center itself, it has a whole range of health areas that it works in, that many of which are beyond the areas that traditional donors work in. And so what we haven't really achieved is starting from the perspective of each community health center, can we supply the entire commodity needs of that health center, instead of only supplying the ones that perhaps have particular public health interests, such as malaria or family planning. So, at the moment, there are other drugs that may not be included. Take a simple one, paracetamol is not really included in a typical sort of donor-funded program, but is an important drug at the community level. So to get paracetamol, they still have to go through the old-fashioned system. So I think we need to turn our program around to say, how do we deliver the entire needs of that community using a drone, and then eliminate the need for that last mile communication entirely? So, with that in mind, I think there are two ways forward that we need to work on. One is engaging the ministry at the central level. We've engaged the Ministry of Health at the regional and district and local level enormously in this project, and we work hand in hand with them, and it would not succeed without that partnership. We've had the misfortune of working during the period in 2020, the period of COVID, and we've not been able to engage sufficiently the central and driven in other directions, and that's perfectly understandable. But I think the next step is we really need to get that central engagement and start that process of saying, what is our roadmap towards having the ministry take over this project and have it become, as I said, banal and ordinary for them to integrate drone delivery into their processes. I've outlined a few of the steps there. I don't want to take up too much time. The second area, again, we've demonstrated a concept. We can deliver regularly, proficiently, efficiently, and effectively products to these health centers. What we've not been able to demonstrate it was never part of the design of the project at this stage, was, is a health center that is fully stocked, will that health in a remote area, will that health center have a better set of health outcomes than an equivalent health center that is struggling with the resupply through this potentially 70-hour delivery mechanism? So what we want to do is we would love to see to sort of go in there and really work on a sort of state-of-the-art randomized control trial approach that will answer that question. Can we have that level of health impact on the community? At the same time, we want to be there are enormous areas for continuous innovation. I think one thing I'm proud of our partnership with Aerometric is the fact that the program design that started maybe a year and a half ago, the capacity, the ability, and the technology that's being deployed has grown enormously during this time period. One of the next steps that we kind of see is even bringing local area Wi-Fi to a drone, within a drone, a transmitter within a drone that would arrive at a health facility and would be able to pick up data from that health facility, not just supplies and biological samples, but actually create a local area Wi-Fi network to collect data that would go into the national health system as soon as the drone has returned back to its base, effectively. So that's another idea there. I've listed a few other areas there, but I've talked quite a bit, and I'd like to move on and allow my colleague Stefan to talk a little bit about some of the areas where he sees innovation. Thank you.
Yes, thank you, Daniel. Yes, the next step could be a national scale-up with only 15 drone sports. We could serve most of the Madagascar population. So with only 15 drone ports. And we can interconnect these drone ports, so we can mesh this network, and we could potentially serve from one drone port another drone port, from one drone port, for example, on the north of the island, another drone port on the south of the island. So we can mesh it in this network, and we could adjust also the delivery capacity easily. We can send drones from one drone port to another drone port. So this disk is our 100 kilometers radius. So you can see we almost cover all the populated region on Madagascar. And the next slide. So we have already transported 38,000 vaccines, vials, while respecting the cold chain. So based on the dimensions of the Pfizer vaccine packaging, for example, we can transport the equivalent of 1,000 vaccines per flight. So if we do a minimum of 3 flights per day, we can deliver 100,000 vaccines per month. So three flights per day, it's really minimum, depending on the weather. But as I said before, this drone is made for very hard weather, so it's not a problem of flying under the rain with wind. And so next slide, please. So yes, if we talk about the vaccines and any kind of medical products, or even the COVID vaccines, the problem of getting medicines in Madagascar, for example, is not a real problem. The problem is to reach the people, and for example, some villages in the northeast region are at 3 days by road, and we can deliver these villages in less than 1 hour and these villages, for example, can't get vaccines. They simply can't get vaccines by road. It's not possible. 3 days by road is not possible to respect the cold chain. So I think that we prove in Madagascar that the drone is really the way to solve this problem in this remote areas. So if you have a question.
Yes, thank you all so much for this wonderful, wonderful presentation on this fantastic project. We have lots of questions pouring into the Q&A, so I will go ahead and get started with asking some of these. If you do have a question that you would like to ask verbally, go ahead and raise your hand and I will call on you after we go through a couple of the Q&A questions. So the first one is for you, Stefan, from David. Is there a safety parachute on the drone, or is that for cargo drop?
There are two parachutes, one on the cargo drop and one on the drone. So there is a safety parachute on the drone. Yes.
Great, thank you. And the next is from Rohan. How was the process for obtaining civil aviation approval? Simple, complex?
It was very complex. Yes, it almost take 2 years to get the authorization from the aviation, the civil aviation in Madagascar. But now we work with them hand on hand, and so it's very easy. We didn't have major incidents in the two past years, so it's now very easy for us.
Thank you. And Sandra and Daniel, this next one is for you from Marga. Funders often earmark the money based on a specific disease vertical, like you were mentioning. So how did you convince your funders to agree for transporting a broad array of commodities?
Thank you. I'll take that question. First of all, we've been very lucky. Our financing from USAID is for an integrated health delivery program. So already it started off from a very integrated point of view. When I say it's not fully integrated, all I mean is it is widely integrated, but there are still some diseases that are treated at the CSB level, which are not normally considered part of a public health program. So those are, they're financed by the Malagasy state, and so they don't really have donor support. They have a cost recovery scheme to keep it going. But the point is, so we need to look at how we integrate those products into our already integrated public health package. I think that's where I'm heading there. Secondly, our Global Fund funding, even though it technically it was focused initially on malaria. Again, we were very lucky because it came from an innovation fund rather than from the traditional malaria funding. We were able to, and with agreement and close collaboration with the Global Fund, they were very comfortable with us adding in vaccines, adding in other products as needed. Okay. So I think our donors have been as flexible as we could hope for. What we want to do is just really see how do we turn it into 100% integrated rather than 67, 70%. Thank you.
Great, thank you. And Stefan, I'll actually ask the question that you're typing the answer to now, because this is an interesting one. From Shakiba, are there relay stations to recharge the drone along the delivery path, or are they charged at specific bases or at the health facilities? And is there any costs related to that insight? I know Joni also had a question around who's paying for the electricity consumption for those charging stations.
The batteries are charged only one time on the takeoff points, the takeoff zone. So Even if we land on the remote hospital, we don't charge the batteries. We only charge the biological samples on the drone, but not the batteries. The batteries are not touched by anyone. So the people from the hospital has only to put the biological samples into the drone and nothing else. And the drone is 100% electric, so as we rent the drone, everything is paid by Aerialmetric concerning the energy.
Great, thank you. And while we're on the topic of costs, I'll ask a question from Marga. Have you measured cost per delivery or any sort of cost parameters within your project? Or is that in the future potentially?
I'm happy to take that. And we've looked at these numbers. And the truth of the matter is, as we're innovating, as we're piloting, as we're learning the process, we've hardly been working at full capacity for the entire life of the project. So as Stefan said, working at maybe 3 deliveries is an easily achievable number. And ultimately, again, I'll probably leave the question to Stefan, but we could conceivably imagine 6 to 8 deliveries as a possibility. Now, when we get to that sort of level of usage and efficiency, I personally think we could end up in the sort of $50 to $100 per delivery range. Now, Stefan may have a heart attack there, but that's where we'll see. The truth of the matter is we're probably closer to, depending on how many flights we're doing per day and all those things, probably closer to $200 to $400 per actual flight that we're doing at this moment in time. We don't have a full methodology around that, as Stefan alluded. At the moment, we're the arrangement between PSI and Aerialmetric is we're paying a monthly rental of the drone. This is part of, I think you may have seen in an earlier slide, I didn't mention it, but part of the risk share for helping get a risky project set up. I don't think Aerialmetric would survive if we were paying them on a per flight basis at this moment in time. But in the longer term, innovations in contracting would be necessary to make sure cost is down. Potentially one day there'll be competition in this area, just as there are multiple trucking companies. I think that's a time into the future, but that's where it would be. Okay, I don't know if that's fully answered the question, but it's a complicated question.
Yes, it is indeed the complicated question here, but that's a great answer. Thank you. And while we're kind of on the topic of efficiency as well, too, we have a question from Serge around how many flights on average are needed to resupply, do the monthly resupply, let's say, for the health facilities and the community health drop points.
I'd be happy to take that question. I'm sure Sandra and Stefan would have other points as well. We've not addressed the situation full on, but in some of my own brief field visits, so I've not been able to visit the field enough this year either. Doing some rough calculations with the people in the CSB and with Sandra, we came looking at how much they claim to be carrying with them on their 2 to 3 monthly visits to come back and forth. My estimate is that roughly a delivery a week would just about meet the needs of an individual health facility. Now that may vary depending on the time, that may vary depending on like malaria season or other seasonal factors, but very roughly a delivery per week might be what is needed to supply the entire commodity needs of the kind of health facilities we're working with. Now that may vary by region, by place, but it wouldn't be massively different from that. Could be up to twice a week, could be once every 2 weeks, depending on the exact size and scale.
Sandra, any other comments from you on that one?
No.
Great, thanks. So next we have a question from Taudis, and first he gives their congratulations on a great achievements, and especially for seeing a local technology partner being part of the solution. So this is a question for Stefan. How long does it usually take for a pilot to get trained? And is there already a pilot licensing system in Madagascar?
Yes, I will say probably 2 months for a junior pilot. About 2 months to be a senior pilot. So the pilots are coming from the school, the aviation civil aviation school in Madagascar. So that's this kind of pilot would normally pilot manned aircraft, but we employed them to be and we train them to be drone operators. So they come from civil aviation school, simply. So we can get this kind of pilots everywhere in the world, because it's the same license, it's the same training in this kind of school everywhere in the world.
Great, thank you. And another question here from Craig for Sandra and Daniel. Madagascar is clearly a resource-constrained environment, and the drone ports provide really great coverage. But in your opinion, having proved this in Madagascar in this very difficult environment, do you think that this can be applied elsewhere and in larger geographies? And what's your opinion on additional use cases potentially to absorb and recover some of those costs, and especially the initial costs of the system, of setting up the system?
I can jump in with a couple of thoughts. One of the things that's been most impressive about Aerometric is the way they've, as I've understood it, they have raised the how to say, the geography roughly from 50 up to now 100. And I think Stefan may say how long a recent test flight that they did was. I can't even remember the number, it's so big. But it probably can be applied to other places. I think a lot of the limitations are going to be around things that Stefan would be able to answer rather than that I would be able to answer. And in terms of additional use cases, I think, obviously there are loads of different, it's not just health that can be served with drones. That's where we are focused, and there could be other use cases that are developed. I think the Wi-Fi, setting up local Wi-Fi and collecting data, to me is one of the most exciting potential areas, but I will let others jump in if they wish.
Yes. Yes, so I can also say that everything which has been done in Madagascar has been done to be replicated. So every procedure, everything that we have made concerning the manufacturing, concerning the operational parts, concerning the training, everything has been written, can be duplicated in other region of Madagascar and in other countries of Africa, for example. So that's not a problem here. I think we have the hardest condition here in this region of Madagascar.
Oh, Stefan, I think we lost you, or maybe you stopped speaking, which is also okay.
No.
Oh, yep, we have you now.
Okay. And yes, concerning the Wi-Fi, you said, Daniel, that yes, we talk about creating making a Wi-Fi, a local Wi-Fi network with drones. So that's possible. We can imagine that the drones would loiter on a village, on the CSB, so a small hospital, and get data from the ground to the drone. That's possible. So we can imagine to design that. Yes.
That's wonderful. Thank you. And we're almost out of time, so I will leave a very hard question for last from Olivier, and this is for the team from PSI. Can you speak a little bit more about the government commitment for your expansion or for continuation of your current delivery networks, and especially for financial support for your next phases? And are you having any discussions with the government or any planning to reallocate some existing government funds potentially to help pay for services? Or do you see that as your future steps?
Thank you for that. I see that very much as the future. I think it is not realistic today to expect the government to be paying. I'm not saying they shouldn't be, but it's unrealistic to expect that they would be taking that on in the very near future. In terms of engagement, as I said, at the local and the regional level, it's been very high. I'm convinced that it would have been much higher at the national level if we weren't undergoing the recent, the COVID crisis that we're even today, Madagascar is being hit quite badly. We were meant to have a workshop just last month. The Minister of Health had said he would be there. In the end, we canceled the workshop because of the COVID crisis. We had to do it online, we were close to getting the minister right in the middle of our meeting. I'm certain that when things start to come down, and certainly as we move in towards as Stefan described, the potential for delivering COVID vaccines in the near future, I think that the engagement will grow. I think we want engagement first. I think we want demonstration. I think we want to demonstrate proof. I think that's part of the role of donors, is to take on that risk early on, and then in the longer term, then we need to work on that health financing angle and make sure that there is some kind of strategic purchasing of drone services delivered by, purchased by the government of Madagascar. That's the point where PSI steps out and Aerometric and other similar entities are there, just becoming part of the ordinary day-to-day service delivery. Thank you.
Thank you so much. And we are out of time now, but I just want to say a very big congratulations to the team from PSI and Aerometric for all of your achievements on this project. It's really fantastic to see this great work that you're doing, and very much looking forward to seeing where you are in a year from now and 2 years from now, and staying updated on your work. Thank you so much for this wonderful presentation today, and thank all of you for joining. We will put any unanswered questions from the Q&A in the presentation that will be sent out next week to all of you. So thank you all, and we hope to see you next time. Have a great rest of your day.
Thank you all.
Thank you all.
Thank you.